Each day is different. Some days I'm seeing patients in the hospital or in our travel medicine clinic. Some days I'm running the fellowship program, and some days I'm working on research projects.
It goes from trying to solve the mysteries of possible infections in children who have fever, for example, those that are puzzling, our colleague doctors in other specialties, to going and sort of being part of a great studies and clinical trials that we do around the world.
It's really interesting going into a day, having a general sense of what it might look like, and then seeing it completely change throughout the day.
Busy, full of activities, a lot of variability, conducting clinical trials, working with my research and development colleagues on new vaccines.
For me, it might be taking care of a critically ill child in the intensive care unit. It might be teaching medical students, residents, fellows, or it might be engaged in meetings in Texas Children's Hospital to plan so that we can provide the best care, the safest care, and prevent infectious complications from hospitalization.
A lot of what I do deals with, for example, polio eradication. What is the best vaccination policy? How we are doing with surveillance of disease, how we determine how long the virus is circulating and where it's circulating and what needs to be done to stop it.
A day in the life of a pediatric infectious diseases physician involves a balance between clinical work, research, teaching, and in some cases, some administration.
I take care of patients, I do some teaching, I may get called about an outbreak of illness or a cluster of unusual illness. Every day is different.
I do clinical research that surrounds education, stewardship, and some other clinical issues. So it's very busy and it's very diverse, and that really keeps it interesting, which I love.
There's such an extreme variety in what my day could be that there's just no one average day, I guess.
Some days I have an outbreak that's happened on the 5th floor and I need to help my team deal with it, or I'm interacting with patients and doing a consultation on a family, or I'm going to visit the CEO and saying, hey, I think we have a problem here, I need to give you the heads up.
You go from seeing a patient to having a phone conversation about setting up a research study, to going then to teach medical students and residents. And I think typically, because the field of the specialty is a cognitive field, I think those aspects are really borne out.
We spend time as a team, which consists usually of medical students, residents, and fellows, seeing the patients, finding out what is wrong with them, trying to understand how we can help, and interventions that we can provide from an infectious disease perspective.
We have a lot of translational work going on in the lab. I spend a number of weeks each year on clinical consult service, seeing what I think are the most interesting patients in the hospital. Some of those kids have infections. Some of them don't turn out to have infections. They have cancer or they have rheumatologic disease, but these are patients that are all very interesting to evaluate.
You never know what's going to happen. It's fun, it's enjoyable, it's intellectually challenging, and many times these patients may actually come to us and we'll get to meet them and take care of them. What I like best about pediatric infectious diseases is that we have a really good chance and a good record of making our patients better.
My day could involve so many different things, from doing antimicrobial stewardship, taking care of children on the inpatient unit, taking care of patients in the outpatient setting, to going to try to think about how we're going to improve how our system works to make sure that the patients are safe.
A day in the life of a pediatric infectious disease specialist can be very interesting, depending on their area of expertise and interest, and also what their institutions ask them to do.
The actual day in the life activities of the research tends to be from as mundane as sitting at your computer and doing analysis, to writing the manuscript, developing protocols, writing the study itself, logistics of designing the study and having discussions around that, presenting your data. So I think there's a whole component of research.
My administrative role is infection control,
which is a great outreach for clinical medicine. We get to think about outbreaks and exposures in the hospital. So it's never a dull moment, and it's always lots of exciting times.
Go to the county hospital in San Jose, California, where I see pediatric infectious disease patients, either both on the inpatient consult service or in the clinic. And all during that time, I'm on call, so if there are calls from the community or from outlying clinics or from the wards, I'm handling those calls.
We have disease strategy teams at the Foundation: HIV, TB, malaria, neglected diseases, pneumonia, enteric diseases. And what my team does is they support those disease strategy teams with vaccine development against those diseases. And then my surveillance group is working with partners to set up a very large network of surveillance sites that are looking at childhood mortality. So as you can imagine, working on that many different diseases and also doing surveillance, a day of my life can be quite varied.
I run a research laboratory, so I had lots of activities that had to do with the administration of my grants, with the supervision of my students in the lab, and my technicians, with a lot of reading in my field of study, collaborations with my colleagues, which has been extremely rewarding to me.
As I went through my medical training, I realized that I wanted to work with children, and when I looked at the fields that had the most impact on the health of children, it was really infectious disease issues that came to the forefront, with vaccination making a huge impact on the health of children, and then antibiotics as well.
The first month of my second-year residency, I fell in love on my ID elective, and there was no going back. And I had really wonderful mentors throughout residency, which really helped solidify my decision.
I got on into infectious diseases because of the book Aerosmith. I read Aerosmith first when I was in high school. That drew me into medicine. And then I reread Aerosmith when I was a resident in pediatrics and was just fascinated with infectious diseases.
I probably knew when I was 7 years old that I wanted to be a pediatrician, and that was just sort of easy to do going through high school and going through college. And then when I was in medical school in my senior year, I rotated on the Pediatric Infectious Diseases Service, and I was on the service with Keith English, who's now chair of pediatrics at Michigan State. And he just showed me what it looked like to be a physician, to be an investigator, to be a teacher. And that really stuck with me over that rotation.
I think a huge part of it from graduate school and medical school through residency and fellowship has been that I've had amazing, inspiring mentors who were pediatric infectious disease physicians, and so I was very motivated to be like my mentors and to make a difference like that.
I decided to be a pediatric infectious disease doctor really as a medical student. It was because I had some phenomenal mentors who really taught me many skills at the bedside.
I wanted to be involved in research. I wanted to be involved in education. I wanted to be involved in taking care of children. And I want to be involved in making our institutions better.
In my particular case, I had great mentorship. And so I would see having great mentors as extremely important in deciding on one's career pathway. And also, it's important to stay focused. One cannot be an expert at everything, but certainly if one were to identify a few areas, not many areas, but stay focused with guidance, that really goes a far way, and certainly in my case, that was essentially what happened.
I've always been interested in pediatrics and in infectious disease, so it seemed like a natural thing probably from my college years or so. I would say at that point I didn't understand what it meant to be a pediatric ID physician and physician scientist. And even if I had, I think the kinds of things that a pediatric ID physician can do now, some of those things we would not have even imagined 20 years ago.
I have a background in molecular biology. I was always very interested in microbiology. And then as I had more experience in clinical care, I gravitated toward the patients that had interesting or challenging problems, and that usually ended up being a good proportion of them had infectious diseases. So it became a natural fit.
The biggest influence on my career choice was a pediatric infectious disease physician who I got to know during my residency training program, a gentleman named Dr. Joel Klein, who's the head of Pediatric Infectious Diseases at DuPont Hospital for Children. He was the consummate clinician, the consummate thinker, and from day one as a resident, I was inspired and awed by him, and I said, I want to be just like him, and I want to be a pediatric infectious disease physician.
Our pediatric infectious disease community is a community of smart people who are interested in building the next generation of people who are in infectious diseases for pediatrics. And I think that we work so well together that those relationships really help us to move forward. And I want to be part of that, and I want to continue being part of that and help with the next generation so that we can continue to grow.
My absolute most favorite part is working with folks in what are high stress and high intensity situations where you need to be able to reach a accurate and early appropriate diagnosis and decision on treatment. And so I really enjoy being able to help people reach better decisions quickly.
One of my greatest satisfactions has been able to sort of pay back that mentorship that others have afforded me, and being a mentor to residents and fellows, helping to guide them on their career path, working with them collaboratively on research and other endeavors is extremely satisfying. And when they receive an award or recognition for something that they've accomplished, it's more satisfying than anything that I personally have accomplished.
I love taking care of kids. We're really lucky that we get to sometimes make kids better. We get to help families take healthy kids home from the hospital. Doesn't always work out that way. Sometimes we just have to be there for families at a very difficult point in their life and support them and their children.
What has been the most fulfilling to me, I think, as an infectious disease person, is to actually work on diseases that are now almost eradicated. I worked on rotavirus vaccine. We don't have that in our hospital. I worked on pneumococcal vaccine. We don't have that in our hospital. I worked on Hib vaccine. None of my residents have ever seen Hib meningitis. Now, I also worked in pertussis or whooping cough, and I must say we're still having that. So we have work to do, so that's good. There's a challenge for our younger people.
Probably what gives me the greatest satisfaction is actually having participated in eradicating the disease. As I said earlier, smallpox was just a terrible disease, and to see it completely gone and gone forever is the biggest highlight.
I think the trick is having a supportive partner and being willing to work around and with each other.
The nice part about working where I am in industry is that we, for the most part, set our own schedules. So we're not tied down to rounding in the hospital at a certain time or tied into specific schedules much of the time. So it's nice to have a lot of flexibility, and so I'm able to balance work and home life.
One of the things that both my kids and my wife have done is they've really committed to saying that we're all in this together. And so when a paper comes out or when a grant is funded or when I'm on service and coming off, I think they feel a part of that. And I think that's critical. Again, it goes back to that team idea that we're all in this together.
Bringing with you your family as your best collaborators. I think the way that you balance those things is knowing that part of your family will participate with you in the process, and that you shouldn't forget that having a family that is happy to your side really pays off for also a wonderful and enriching career in what you do.
I'm able to balance it because I'm a very organized person. I try to set specific goals, and then I also have opportunities and take opportunities to take breaks and engage in activities that I enjoy, such as sports, the arts, reading, and sometimes just a nap.
What I do is make sure that I'm still doing some of the things I love that aren't work. It's important for me to exercise. I love the outdoors. I love to hike. I love music. I play accordion. I don't tell too many people that. And so just setting time for those things, because I found if I play hard, then I can work even harder. And so I try to make sure I keep that balance intact. But you have to get it on the schedule. and I actually, pencil this stuff in, otherwise it doesn't happen.
Pediatrics and working with children and their families has boundless rewards. Pediatric infectious diseases also has boundless rewards. In infectious diseases, we usually know what's causing the problem. It's often a virus or a bacterium or a fungus, for example. And we have drugs for most of those that can eliminate the problem.
There's really a myriad of options out there, and to really seek those out and embrace them. There's not just one size fits all or one way to do things. And I also try to remind people that because they do something to start, that doesn't mean that's going to be their whole career. Many people morph over time, and that's part of the beauty of ID, is that over time as you develop, you get to do so many different things.
The field of ID touches every aspect of pediatrics. It's not an organ-specific or a location-specific specialty. And if you're interested in making a broad impact on a number of children and answering those good questions, the field is flexible enough, whether you want to do basic science or clinical research, clinical care, or even what I'm doing, making an impact in industry.
I think the biggest thing for those who are considering this field is that there are a lot of myths that are out there. I think the first myth is that the job doesn't pay so well. It pays fine. There are others who will make more than us, and that's just fine, because we get to do what we want to do, and we get to serve in a way that is incredibly beneficial to those around us.
I think there are a lot of opportunities in pediatric infectious diseases, and I would encourage them to talk to more than one type of Peds ID doc and really get a good picture of what they could do with that training.
I view it as a career that's not just treatment, but very much involved in prevention on every level and every scale.
I think the spectrum of career opportunities is very diverse and exciting for pediatric infectious disease specialists.
Pediatric infectious disease specialists tend to get along with each other. We work well together. And so I will tell people that we have a very fun, caring specialty where people work together, care about each other, and that it's all together a very rewarding career pathway to consider.
Choosing pediatric infectious diseases allows you to gain expertise that you can take into almost any forum for a job. So if you become a pediatric infectious disease specialist, you could still practice as a hospitalist. You can go into infection control, you can go into antimicrobial stewardship, you can go into administration, you can go work through the health department or the National Health Service, or go globally. And I don't think that all subspecialties allow that sort of flexibility, and I think it's underappreciated.
And I would encourage you to talk to somebody who's a pediatric infectious disease specialist, because you'll meet 10 people and they'll all have a different job description. So that's what's exciting about the field. There's not any one job that somebody does.
I'm never looking at the clock saying, oh, is my day almost done? I'm excited to come back to work the next morning.
You have to be able to enjoy that atmosphere of working with patients and with families and taking care of kids. But you also have to have an innate curiosity and want to answer questions, whether it's a question that's a basic science question, a clinical question with a patient, it's an outbreak situation, it's antimicrobial stewardship. You have to be interested in answering those questions, and that keeps you going forward.
It's a special thing, it's a special effort, and we have an ability to really impact large numbers of people with both vaccines and with drugs.
We're very fortunate to have a very active Pediatric Infectious Disease Society, which is very supportive of trainees and faculty and offers a great opportunity for people to interact and meet, and is something that I would strongly advise trainees to be a part of, because it really can help establish collaborations that can set you on a wonderful career path.
The pediatric infectious disease field is extremely interesting and intellectual, and there's just so much that you can do with it.
This is a specialty where you can change not just one patient, you can change the world.
Infectious diseases doctors have been the Sherlock Holmes of pediatrics, and only the most talented are basically the ones that have come to this specialty. So
it is not a specialty in which you will be bored a single day of your life. There are always new things to learn, and even after these many decades in practice, I am still learning every day. There are new pathogens that are being discovered. There are old pathogens that are behaving differently than they used to before. There are new discoveries in prevention methods, in vaccines, in therapeutics and diagnostics. It is just a very exciting field to be in.
For me, it's just been an incredible launching pad to a world of opportunity that I never dreamed existed. So yeah, I would say absolutely check it out. It's an incredible, incredible field.
We really make a difference. So I think there's lots of opportunity, and it's a really good time to consider a career in pediatric infectious diseases.
The world is your oyster when it comes to pediatric infectious diseases, and you get to create it. And there's so many things that need to be done that's why, I mean, it's an exciting field. And lastly, I would say is that, you know, the people you'll meet in pediatric infectious diseases, best people you'll meet anywhere, supportive, fun to be around. I think these meetings, demonstrate that if you get to come to one to hang out with us, so to speak, and I think it's a great field, and anybody would be lucky to be a pediatric infectious disease physician.